It takes women 4 years longer to be diagnosed with the same chronic medical illness as men.
We are not identifying young women and girls.
I heard everything from, you're just tired.
When I got my diagnosis, I think I started crying.
Well, I think it's just because you have your period.
Endometriosis, more common in women than diabetes, yet too often ignored or misunderstood.
To myself, so all this time, like, it wasn't me.
Compare these two scenes. Now tell me, which one of these two do you think is a heart attack? Oh my god, are you okay?
Hey, I feel really tired.
You should probably get some sleep.
I have, but like, I don't know, maybe it's just due to stress.
Try eating something.
I don't know, I just don't feel like eating anything right now.
I don't think it's that serious though.
Maybe. I hope so.
Alright, so what do you guys think?
So how many of you guys said scene 1? You guys are kinda correct. Kinda not. For women, it's not always gonna look like this. In reality, the symptoms might actually be more subtle.
Later on, the person in the second scene ended up hospitalized for a heart attack. Heart disease is the leading cause of death for women in the United States and affects women at any age. That's over 60 million women, or 44% in the United States, are living with some form of heart disease.
Shared symptoms for men and women include squeezing chest pressure or pain, jaw, neck, and back pain, nausea or vomiting, shortness of breath. For women, the list continues, including fainting, indigestion, extreme fatigue, experiencing chest pain sometimes.
Heart attacks aren't the only thing that many doctors get wrong about women. Check this out.
Nice to meet you. I'm Dr. Fretman. Please take a seat. So, I heard you've been feeling uncomfortable lately.
Yeah, I've been feeling a lot of pain down here.
Okay, eat anything bad?
Not really.
Okay, anything unusual happen?
I just started my period and it starts.
Okay. Well, that's nothing. That's totally normal.
Is it supposed to hurt?
Yeah, I mean, just take some painkillers and you'll be fine.
This patient actually has endometriosis.
Endometriosis is when cells similar to the lining of the uterus grow outside of the uterus. This tissue can cause pelvic pain, envelop the ovaries and fallopian tubes, and even affect nearby organs such as the bladder and bowel. It can also get irritated and develop scars, and in the ovaries, cysts can develop. Hormones released during the menstrual cycle only worsen the pain. Doctors often ignore symptoms, but even worse, they may misdiagnose and leave women untreated for certain conditions.
Hey doctor, I've been having really difficulty concentrating and I've just been really restless.
Have you been sleeping well?
Not really.
You have anxiety and depression.
Wait, what do you mean?
Those are some classic symptoms. You haven't been concentrating well, and you're not doing the things that you love.
I guess.
I'm going to prescribe you some medication.
Okay.
This is a classic case of misdiagnosis.
Women's symptoms of ADHD have often been mislabeled as depression or anxiety, as they dealt with feelings of restlessness or difficulty concentrating, leaving ADHD untreated. ADHD also presents differently, especially in children. Young girls usually display inattentive symptoms, while boys are usually hyperactive/impulsive, which is easier to notice than the former.
Hey doctor, I've been hoping to get a tubal ligation because I don't want children in the future, and I think this is what's best for me.
Are you sure?
What do you mean, are you sure?
That means you're not going to have any children in the future.
I don't want children.
That means no children.
Yeah?
I don't think you should do this.
Clearly, this patient wants to get the procedure done, but the doctor just refuses.
Tubal ligation, or getting your tubes tied, is a permanent procedure that ties and severs the fallopian tubes to prevent fertilization. However, it can be difficult to get approval from a doctor, as they can deny the procedure based solely on their belief that the patient will eventually want children.
These beliefs and assumptions inadvertently hurt patients. They take away a woman's bodily autonomy and their right to reproductive choice.
Women face so many medical malpractices that are just chalked up to be normal.
It should not be normalized, and women need to speak out about this.
Don't go to someone who will ignore your problems or push their opinions on you.
If you think you're not heard, Go to a different doctor until your voice is heard.
Donate to causes that fund for women's investigation and diagnostic symptoms and be active.
This is not normal.
Wrong.